made him the most popular oncologist, a wonderful clinician, and equally celebrated academician. Welcome to the live session, sir.
Good evening.
So I have got close to 30 commonly asked questions, sir. When it comes to breast cancer, the first and foremost question, why is breast cancer so alarming?
As you are all aware, breast cancer is the commonest cancer affecting women all over the world. Even in India, it's the commonest in urban women. It's alarming now because when I entered the field of cancer in 1971, out of 100 women developing cancer in Madras, about 18 developed cancer of the breast. Whereas in 2020, out of 100 women developing cancer, 45 are from breast cancer. So about 250% increase in about 50 years time. It's definitely alarming. It's like an epidemic. Okay, so that's one of the reasons why we are concerned about this breast cancer, and we are celebrating this month as Breast Cancer Awareness Month.
So what are the reasons and causes for breast cancer, sir?
Well, there are many reasons and causes for breast cancer. It's not an infection, just to say that this bacteria has caused this. This is a lifestyle disease. There are many factors. We call it risk factors that are responsible for higher incidence of breast cancer. Number one is number of children. Olden days, women used to have 7 or 8 children, and they breastfeed the children for 1.5 to 2 years. So overall, 20-25 years, they are busy with the family. And nowadays, women have only one child, and they give, if at all, 2 to 3 months of breastfeeding. So this is one of the main reasons. The breast developed due to female hormone, estrogen. It's continued estrogenic stimulation of the breast without interruption. It's one of the factors causing breast cancer. So if there is only one child and a few months of breastfeeding, the rest of 30 years, the breast is being stimulated by estrogen unopposed, and this causes the breast cancer. This is the first factor. Second factor is obesity, overweight. Now, as you know already, that estrogen is responsible for breast development and breast cancer formation. In overweight, the fat cells also secrete estrogen. So this increased secretion of estrogen stimulates the breast, causing higher incidence of breast cancer in overweight women. The third factor is some hormonal factors. For example, women developing menstrual periods before the age of 12. Women continue to have periods after 55. That is, for a long period of time, the breast is stimulated by estrogen, so they stand a higher chance of developing breast cancer. Another factor is if the first child is born after the age of 28, they stand a higher chance of developing breast cancer. Fourth factor is about 40% of women in their lifetime develop breast lumps, some type of breast lump. Majority are not cancers, but we cannot ignore breast lumps. We have to do needling and do a biopsy. If it shows atypical cells, then that is going to develop into a cancer.